Vonadigion yn bod y digasau, diolch yn fawr. Bod y da, a croeso I Lansiawd Canolfan Prime Cymru. Good morning, everybody, and welcome. It's very exciting to be here, and it's great to see you, and thank you all for coming. My name is Adrian Edwards, but introductions in a moment, actually. This is an auspicious day for us. We're here to recognise and mark the launch of Prime Centre Wales, the Centre for Primary and Emergency Care Research in Wales. Now, so many people have been working to get us to this point, and I want to thank you all really very much for all of that, particularly including the Wales School of Primary Care Research that was, and the Trust Network for Unscheduled Care that was. And we came together and have been working for the last couple of years to get to this point of launching Prime Centre Cymru. All sorts of disciplines, all sorts of people have been involved in that. Public, patients, clinicians, academics, of course, third sector, social care, university, and government. All these groups coming together and arriving at this point. So my point is this is your centre, and it really is a huge privilege for me to be serving you, and you on behalf of the population and people of Wales, and in particular the service users of the NHS in Wales, as your director. So it is your centre, and we want to do this really important work. It is important and urgent work in this sector. It's a new beginning for us now, and it's actually a new way forward to make the advances in the field that we really need. The way we're working is founded on mutual interest in this area and mutual respect. And as we shall describe, we're integrated across Wales, across universities, across sectors. And our business is co-producing health and healthcare with the people and public of Wales. So we need to work together for that greater good. And that's what we're here to discuss and to celebrate and to kick it off this morning. Now, for some introductions, my name is Adrian Edwards. I'm a Professor of General Practice and Population Medicine in Cardiff University, and I am the lead director of Prime Centre Wales. I'd like to introduce my fellow co-directors down here at the front. So Professor Helen Snooks is Professor of Health Services Research at Swansea University. She's also the director of the Swansea Trials Unit, and she's our lead for emergency and unscheduled care research. Professor Joyce Kenkry from University of South Wales is Professor of Nursing and is our lead for long-term conditions and our strategic lead also for social care collaboration. And Professor Richard Neal is Professor of General Practice at Bangor University and co-leads an area of work around screening, prevention and early diagnosis, particularly in relation to cancer symptoms and outcomes. The structure for this first session is that I will start in a moment with a few general comments about the need and importance for primary care and emergency care research. I will then hand over to Helen, who will talk to you about our aims and the way we're set up to do this work in Prime. Then we'll hand on to Joyce, who will talk particularly about how we work with our several partners in this field. And then Richard is going to talk about some recent successes that we've already had, showing specifically how the group has come together and has added value to what we're doing here by bringing in the different perspectives, disciplines, sectors, etc., now forming as Prime Centre Wales. But none of this would be possible without the substantial funding going into Prime. So I do want to acknowledge and thank our funders. These are, of course, Health and Care Research Wales, thank you, Jonathan, to the tune of £2.7 million over 3 years. But I also want to thank and acknowledge the other funders who are from the 4 collaborating universities. So particularly those represented here, we thank you and acknowledge you for those contributions. They have put in an extra 0.9 million, so it makes a project of 3.6 million over 3 years. So we are hugely grateful for that and energized to get on and make some important progress in this field. Marvelous. Right, why do we need to do research in primary and emergency care? Well, we start with the obvious. 90% of all healthcare encounters in the NHS take place in primary care, albeit on only 9% of the budget. So we are very good value for money, but we are a big part of the healthcare system. And what that means is that any small change, positive or negative, in primary care will have a massive effect elsewhere in the system. So if primary care sneezes, secondary care or social care catch a cold, okay? It is an important sector of our health service, but also emergency and unscheduled care. Those of you who heard me speak in May saw this photo before. We're well familiar with this concept of ambulances queuing up at hospitals. These are Welsh ambulances. It could be any Welsh hospital, actually, couldn't it? And the importance of making improvements in the service is extremely high. Now, again, those of you who heard me talk in May heard me describe an anecdote. Have you got time for another anecdote, a different one? What I said then was that the people in those ambulances may be the lucky ones, because it may be the other people who can't get an ambulance because they're queuing up at the hospital who are really unlucky. The anecdote is unfortunately a story of a tragedy in my practice just 3 or 4 weeks ago. A 4-week-old baby had a cot death. He died suddenly and unexpectedly in the night. Now, I could tell you that the ambulance took about 20 minutes to get there. Were there problems in the service that night? Why couldn't they come in 8 minutes like they intend to? Would it have made a difference if they'd been able to get there quicker? Now, in this particular case, I actually don't know that it would have made a difference. I suspect not. Various other factors around it. But I've also been asking myself the same question, because I saw the mum and the baby the day before. So it blew me out as well. I've been doing a lot of reflecting in these last 3 or 4 weeks. Is there something I could have done differently the day before that would have made a difference? Probably more slowly than other people around me, I've been coming to the view that actually also it wouldn't have made a difference. There wasn't anything that I could have done differently. But other people were pointing that out to me more quickly than I was, concluding it. But collectively, what the case illustrates for us, was it a huge quality and safety issue in primary and emergency care? And as well as the unimaginable impact on the family, it also makes us think about the impact on the providers. There was impact on the health visitor, there was the GP, there was the practice, the ambulance staff, the paediatricians. All were affected in a big way as well. So there are also issues about how do we look after our workforce to actually put them in a position to be able to provide good quality care, the best possible care for all our patients and families. The baby's funeral was yesterday. These are real issues that remind us about the importance of trying to do everything we possibly can to improve primary and emergency care around us and through research. What we know is that strong primary and emergency care is essential for the effective and efficient functioning of the NHS as a whole. And clearly what we say in this audience is that a strong academic base must underpin this to enable us to make that progress. Now, how do we actually know this? Is it just about these anecdotes? Or is there actually evidence? This is long-standing evidence from Barbara Starfield, one of the leaders of primary care research, who showed that the best healthcare outcomes in different countries correlates with the quality of primary care in those countries. It's worldwide evidence. The higher your rating or ranking of primary care, generally, the better the health outcomes are in those countries. Although you will see that we have a little gap here in United Kingdom, if we were going to be where we should be on that line. So we have a lot to do to improve primary care, in particular, emergency care related to it. Now, how did they make those primary care ratings? Well, in that piece of work, it was based on the traditional features of primary care, based around first contact, person-centered care over time, comprehensive, coordinated care, family-centered and community. All those things that we probably, to some extent, take as read. But the issue that's actually missing from that analysis is around the complexity of care. That's what's coming more and more in all healthcare, but particularly in primary and emergency care, largely because of the aging population, and with that comes multimorbidity. The combination of conditions and treatments that makes it even more difficult to work out what is the right thing to do, as well as complexity in health and healthcare needs. We have to say it's also increasingly complex the way health and social care provision is provided. So the appropriate use of services is a big issue for all of us doing research in this field as well. So there are a number of challenges that we're facing, as well as those general challenges around aging and multiple morbidity. There are particular issues for us in Wales. We know these, the inequalities in health and healthcare. They're real, they're really important. For example, if you live in Blaenavon, at the top end of the Eastern Valley all your life, your average life expectancy is 78. If you live 5 miles down the road in affluent Abergavenny, your average life expectancy is 88. So yeah, 21st century, that's what we've still got here in Wales, is a 10-year at least difference in average life expectancy. So health inequalities are a massive issue for us that drive us on as well. And the issues around healthcare delivery. We've discussed about the demands and the needs, but also the other feature I think that goes with that is about supply-led demand. Sometimes the more you supply, the more is used. And the issue is that of benefit to patients? We will probably hear more this afternoon from Fiona Godley about issues of over-treatment and over-diagnosis, where healthcare systems seem to want to do more and more to patients, for patients, at increasing cost and at very limited extra benefit for patients. And that is actually unsustainable in the current climate. So we need to think about how demand happens, how we provide for that demand. And we need to think differently than just doing more. We need to think a little bit about reconfiguring health services, but also can we do more in the way of prevention and more care in the community and so on. And for all of those things, an evidence base is absolutely vital. So now I'm going to hand over to Helen, who's going to introduce us to what we intend to actually do about some of those problems.
Thank you, Adrian. Hello, everybody. It's a pleasure to be here today. As Adrian said, I'm going to talk a little bit more about, well, I would do. There we are. About the work programme of, it's not up there, it's down here. I've broken it. It's pressing the wrong button maybe on here. I'm trying random buttons. Yes.
Because you pressed the middle one.
Yeah, press the middle button. Thank you. And Adrian did earlier. Okay, so as Adrian has already described, we are an All Wales research network, an All Wales centre, with, I guess, posts in Bangor University, Wrexham, Swansea University, Cardiff University, and University of South Wales. And it's the point to make here is this is a real collaboration, that we're all working together, and we hope to bring added value through that collaboration. Many of us were already working together before, but this infrastructure funding has allowed us to really identify joint research interests and to work sometimes where we would have gone across to the border to English partners. Now we're working with Welsh partners more. So that's got to be good. We are multidisciplinary. So we have specialists in Prime Centre Wales who are community-based, based in general practice, emergency and scheduled care, as you've heard already, community nursing, allied health professionals, social care, social policy, social sciences, and integrated and immediate care. So it all very much depends on the project and the topic and the area that we're working in, the research questions that we have as to who we form partnerships with. And these specialisms are all are available to us within the network. I don't think I need to go back through the leadership team, as Adrian did that at the beginning. Adrian, Richard, Joyce and myself, but behind each of these is a team in their respective centres, and this is very much a team effort. So what are we aiming to do? We're very much focused on, this is not an ivory tower doing research for the sake of research and putting it on the shelf exercise. This is very much about bringing in research money into Wales to carry out research which will inform healthcare and improve the health of people in Wales, but not just in Wales, internationally also. We wouldn't be able to carry out research at the level that we aspire to without producing internationally relevant evidence. So we aim to carry out high-quality research, influence policy and practice, to grow and collaborate, and to translate, transfer, and most importantly, make an impact. So as I said, we're not in the business of carrying out research because we're interested in that and we want to build up our own CVs. We want to impact on the health and well-being of population of Wales and beyond. So I'm in danger of not knowing when I've got to hand over, but someone will tell me, I think. So we have divided ourselves and organised ourselves into work packages, which are listed here. Each of these work packages has a lead, and it's a very difficult thing to do because a lot of, as you'll see from the topics up there, a lot of these work packages are overlapping. So lots of the pieces of work that we undertake will tick several boxes. But in the interest of being thematic, we have put together these work packages in long-term conditions and comorbidity, patient-centred and prudent healthcare. You can see a huge overlap there already. Infections and antimicrobial resistance, screening, prevention and diagnosis in primary care, unscheduled and emergency care, including pre-hospital care, patient safety and healthcare improvement, oral health and primary dental care, and methodological innovation, and which really goes across all of those work packages. And there are other themes that go across all work packages, which are with the School of Social Care Research, the Wales Cancer Research Centre, and the clinical trials units in Wales. They're not exclusive. We also have links with the Welsh Health Economic Support Service and the FAR Institute. So we're about working with whoever we need to work with to put in the top proposals and attract money and then carry out the highest quality research possible. It's handover time. Thank you very much. Joyce.
So I'm Joyce Kencrey, and I'm covering some issues about how we're working together. So We have actually, as a team within Prime Centre Wales, have been a long time working with patients and public across a range of projects and also through the different stages of research. And we think that that's very important. And we hope to be taking that forward even further. And it's the idea of how we're going to actually work across health and social care. And today we've got people from industry, and we've been working with industry over the years, and that's been enabled by the South East Wales Academic Health Science Partnership. But also it's about how we are linking then in with the rest of the infrastructure. And it's important that we as a Prime Centre Wales is actually interacting with the other centres of excellence in Wales and also the infrastructure support and units. Okay. Any good? Yes. Yes. So how are we working with other people? So in actual fact, under the Wales School of Primary Care Research, we actually developed by consensus the Community Nursing Research Strategy, and that's been led by Caroline Wallace from the University of South Wales. But also we've gone on and helped other groups to develop agreement on a way forward. So we've worked and developed with the occupational therapists their strategy to take forward research in Wales. But we've also been working with the public health in Wales and with nursing and allied health professions, working together to develop an action plan for thinking about how they can, as a group, improve the health and well-being of the population of Wales. So we're really trying to get people to work together and actually developing collaborative projects across universities and across sectors. We've also been trying to think about disseminating information, but it's also not only publications, but it's getting the information across to the public. And more importantly, we're introducing people to people. And it's people within sectors, within the population, to take forward research. But not only research, it's the findings of research, so they get implemented into practice. Okay, so we are originally thinking about health, but in actual fact we're thinking about how we can actually work across health and social care. So we're actually setting up a meeting, and you can welcome to come to the meeting, and it's really thinking about how we can work across the sectors and come to agreement of how to go forward. So we're planning to set up a day, and that's on October the 5th, and it's really working together and people coming together with their ideas and coming to an agreement on a way forward. And from that, we intend to set up a strategy board and an action plan. But it's also to make sure that we actually take forward research. And one of the projects that's been going forward is a project looking at complex needs of the population and how that can be influence the impact on care in the future. So here's your invite. It's on at the Future Inn, and you can register for it on the website. So it's really trying to bring people together, and the aim to identify research issues, prioritise these, and establish collectively how they can be delivered. But we're also doing another event the next month, and this is on November the 10th, and it's at the Priory at Abergavenny. And that's really trying to say, well, how are we going to address long-term conditions in Wales? And how can we actually work together and collaborate? So it's to identify issues again, prioritise these, and actually address these together. and thinking about how we can develop research programs of work across organisations, across sectors. And you can register on Prime Centre Wales website. So really, we're just saying what some of the has been happening already. So there's been a partnership that's called Scoop, and what they were doing was investigating social care use and emergency care admissions. And what they did was actually use the databases linking health and social care together from the city, the county, and also SAIL database. And they found that in actual fact, that if they targeted appropriately with social care, actually prevented admissions and reduced length of stay. So it's just saying how we can use to our benefit, working across health and social care. So I know today there are members here from Success, but which is a user group for chronic conditions. But there's also members of the public here from other groups in Wales that are helping us to take forward research. So Success have been actually developing and helping research across the whole research cycle. So identifying and prioritising research, they've been commenting on proposals, they've been developing proposals, and also they've been helping presentation of the results. So we hope to set up a faculty for Prime Centre Wales and really inviting people to a forum of discussion for the future. And so it's inviting everybody to be part of the group. And it's not only from the health organisations, social care, the public, and also from the professional organisations to actually come together, collaborate, and look forward to developing research and outcome and evidence into practice for the health and well-being of the population of Wales. And I'd like to hand over to Professor Richard Neal, who leads for prevention and diagnosis.
Thank you. It's lovely to see so many of you here. I don't know whether I dare use this or not. Probably not, actually, I think. I've got to get this going. There we go. It seems a bit rich to be talking about successes at a launch meeting, but I'm going to do it anyhow. And there's a good reason for this. Whilst in Wales we have been working together as a group for a long time, I think before the advent of Prime Centre Wales, we'd all got a little bit lost working in our silos, and that's not just the universities; it's just the institute, the other organisations between them as well. And what was then the NISCA call to put Prime Centre Wales together, it actually made us all work together to find out about each other. And I remember very well, and this is important in the context of this slide, that when we had our interview for Prime Centre Wales, at the end of the interview we sat outside and had a coffee and debriefed ourselves and thought, well, whatever happens with this, we're going to work together more because we'd have found out about each other more. So the fact that we've got early successes to show here, which is 6 months since the funding began, is a reflection of work over the last year of INSATF and working together and getting to know each other. And you'll see from this slide that there are already grant successes around small children, around patient safety, around patient choices in cancer treatment, about the evaluation of cancer services, about data linkage for ambulance trusts, and about record linkage for self-harm emergencies and so forth. So you'll see there across the spectrum there is work that involves all the 4 universities and some of our partner organisations outside. There are also some other early successes that we're not allowed to tell you about yet, so you'll have to keep watching our website for that, but we have had some other significant successes which we can't make public today. Maybe next week, but not today. So it's all about adding value. I'm not going to read through everything on this slide, but it's there to demonstrate that in addition to successes in grant funding, there are lots of other things in the pipeline, something like 55 grant applications already submitted, which would badge under the Prime Centre Wales umbrella, and that's just a reflection of the way in which we're working and the way the funding has allowed us to get researchers to begin to work together and to mandate ourselves to work together. In our targets, the things that Health and Care Research Wales will call us to tune on in 3 years' time to say, have you done this? We've not only mandated ourselves to bring in certain amounts of grant money in each of the work packages, we've mandated ourselves to work together, and that's deliberately done for a reason, so that there is more cross-collaboration between institutions for mutual benefit and the quality of the application. And as you've heard from Joyce, we've got excellent partnerships established with social care, which I think makes Prime Centre Wales especially unique. The grant successes extend to tendering for the Care Council project there, and also for a number of PhD students, which is our breeding ground of future researchers. So these are the people that will be taking on becoming principal investigators in Prime Centre Wales in due course. I've just got 2 or 3 examples of these. This one is, again, it involves Swansea, Cardiff and the ambulance service. So it's a big study about validation of a tool for TIAs in the paramedic setting. And these are just a number of examples. A big study of urinary tract infection, which again involves both Cardiff and Swansea. And this one is particularly pertinent about prudent healthcare. Fiona Wood has led this, and it actually involves co-applicants from the 4 universities involved, and is particularly apt because it shows the linkage of the alignment of Prime Centre Wales' work with government policy. So this is a really important study around understanding prudent healthcare and developing intervention about how to communicate prudent healthcare through our workforce. So a very applied, practical piece of work which will start very soon, and I'm very much looking forward to be involved in. And at that point, I'm going to stop talking about successes in the infancy of our Prime Centre Wales and hand back to Adrian. Thank you.
Thank you so much, and welcome, the Minister.